That certainly is a hard story to listen and to feel all of those things with that family. We just, heard about how the advanced care planning, how important it is to that family and to others. It's more than just documents, though, and we want to kind of help you figure out how to start conversations with friends and family on today's To Your Wellbeing. So we have Dr. Jean Freeman with Cone Health Palliative Care Services. All right, so, when we start with this, when someone would start thinking about advanced care planning, what would or would they not want at the end of life? I think most of us don't even know where to begin.
And so that's something where really it's a combination of putting together things that are important to you as far as your values in conjunction with outlining those so that really it's available to have the healthcare team work in conjunction with what's important to you and the medical reality of whatever your situation is to come to a shared plan to say, how can we move forward based upon all those important things?
All right. Is there like an example that you might be able to give, like one example of how you would want something to move forward or how you wouldn't want something to move forward?
A lot of times when I sit down with families and talk with them, it's one of those to say, well, what are the important things? And often the important things can be spending time with family or being out of the hospital or being able to see my grandkids do whatever it is. And so whenever we start with advanced care planning, it always works best to start with what are our goals? What are the things that we're working towards? What's important to us? And after we have those important things, you start to work backwards to say what medical things are likely to get us closer to those goals. If not, it almost feels like you can come to the hospital and you get a menu of here's all the things that we offer at Cone Health and what do you want done? Where I think we really need to start with what's the important thing we're trying to get to. And after we have that, we can work backwards to say how do we best meet that goal in light of the challenges that somebody has with their current medical situation.
All right. And so, this is a really big topic. And so people probably would not know what they would want. They would need to talk with someone who knows the kinds of questions to ask.
And a lot of times that can be helpful. Most of the time, whenever I sit down with a family, though, it's to talk about what are those essential things that make us an individual? What are the important things to me? And then working to say, in light of any chronic illnesses or acute illnesses, how do we focus on those things? You're right, though, it can be something that's very beneficial to have a guide, whether it be a medical provider. There are many resources available even online now in other areas to really try and say, how do we process in a very thoughtful way what our next step should be? How do we go about outlining these important things? What are those important questions?
And these sound like a really hard conversation, a hard topic, but you're calling it a gift, and we're going to have you explain why you call it a gift when we come back from our commercial break. We're going to talk about why it's a gift, how you and your family can start talking about those things, and how do you bring it up over the holidays. That's coming up next.